Welcome to Clinical Tools Library, evidence-based scales and questionnaires designed to support healthcare professionals in practice. The Vineland Adaptive Behavior Scales, 3rd edition, assesses adaptive functioning across multiple domains. It evaluates communication, daily living skills, socialization, and motor skills. The tool measures how individuals perform tasks required for personal and social sufficiency. It is commonly used to assess developmental disabilities, intellectual disabilities, autism spectrum disorder, and other conditions affecting adaptive behavior. The main purpose of the Vineland Adaptive Behavior Scales 3rd edition is to provide a standardized method for identifying strengths and weaknesses in adaptive behavior. This information supports diagnostic assessments, intervention planning, and monitoring of progress over time. The assessment relies on caregiver or informant reports to gather relevant data. The Vineland Adaptive Behavior Scales 3rd edition is indicated for individuals from birth to 90 years of age who require an assessment of adaptive functioning. It is most useful in clinical contexts involving developmental disabilities, intellectual disabilities, autism spectrum disorder, and acquired brain injuries. The instrument evaluates communication, daily living skills, socialization, and motor skills, providing standardized scores that aid in diagnosis, treatment planning, and monitoring of intervention outcomes. Its use is critical in multidisciplinary evaluations to inform eligibility for services and to track changes over time in adaptive behavior. The Vineland Adaptive Behavior Scales 3rd edition consists of approximately 429 items divided across 4 main domains: communication, daily living skills, socialization, and motor skills. The assessment is conducted through a semi-structured interview or a parent/caregiver rating form. Questions focus on the individual's adaptive behaviors, such as verbal communication, self-care, interpersonal relationships, and fine and gross motor abilities. Response formats include multiple-choice ratings that assess the frequency or independence of behaviors, typically scored as never, sometimes or partially, and usually or habitually. Administration begins by selecting the appropriate form based on the individual's age and cognitive level, followed by systematically asking questions to gather detailed behavioral information. Scoring involves summing raw scores, which are then converted into standard scores, percentile ranks, and age equivalents based on normative data. Standard scores have a mean of 100 and a standard deviation of 15, with scores between 85 and 115 considered within the average range. Scores below 70 indicate significant adaptive behavior deficits, suggesting potential delays or impairments. Interpretation requires examining domain scores to identify specific strengths and weaknesses within adaptive functions while considering the individual's developmental context and clinical history. Sensitivity refers to the ability of a test to correctly identify individuals who have a specific condition, reflecting true positive rates. Specificity measures the test's ability to correctly identify those without the condition, indicating true negative rates. The Vineland Adaptive Behavior Scales 3rd edition demonstrates variable sensitivity and specificity depending on the cutoff scores and populations studied. For example, in assessments of developmental delay and intellectual disability, sensitivity values have been reported around 0.8 to 0.9, indicating a high likelihood of correctly detecting individuals with adaptive behavior impairments. Specificity values often range from 0.7 to 0.8, reflecting moderate accuracy in excluding individuals without such impairments. Clinically, this means that a practitioner using the Vineland 3 can expect the tool to identify approximately 85% of individuals with adaptive deficits, while correctly classifying about 75% of those without deficits, balancing the risk of false positives and false negatives in diagnosis. The Vineland Adaptive Behavior Scales, 3rd edition, is grounded in a robust foundation of validation studies and empirical research. Beginning with its original version developed by Edgar A. Dahl and colleagues in the mid-20th century. This instrument was created to measure personal and social skills required for everyday living, particularly among individuals with developmental disabilities. Subsequent revisions have incorporated rigorous psychometric analyses to enhance reliability and validity. The Vineland 3 demonstrates high internal consistency, with coefficients typically exceeding 0.9 across various domains, indicating strong reliability. Test-retest reliability over intervals of 2 to 8 weeks has been reported at values above 0.8, supporting its temporal stability. Its criterion validity is supported by significant correlations with other established measures of adaptive functioning and cognitive assessments, reinforcing its construct validity. Moreover, normative data were obtained from a large, representative sample reflecting diverse demographic variables, enabling standardized scoring and interpretation across multiple age groups. Factor analyses have confirmed the theoretical structure of adaptive behavior domains, aligning with the conceptual framework established by earlier editions. Cross-cultural studies further affirm its applicability within various populations, though ongoing research emphasizes the need for continued validation in diverse contexts. Collectively, these findings underscore the Vineland 3's status as a scientifically validated tool for assessing adaptive behavior in clinical and research settings. Thank you for watching. For complete information and official PDF resources, visit clinicaltoolslibrary.com or check the link in the description below. And don't forget to like and subscribe for more clinical insights.